Hi, this is Ian Katz, dermatopathologist, and I thought I'd just highlight the problem of distinguishing between the various forms of actinic keratosis and squamous cell carcinoma. The problem is there's essentially one continuous process ranging from actinic or solar keratosis to in situ squamous cell carcinoma, early invasive squamous cell carcinoma, and regular squamous cell carcinoma. If you look on a graph, you can see that there's essentially one continuous process. There's no real cutoffs between each entity, and different pathologists will obviously have slightly different cutoffs between each entity. Even one single pathologist may have slightly different cutoffs on different days. The problem in the literature is there are actually no definitions between all the different entities. It's very difficult to determine when a squamous cell carcinoma is early invasive or just in situ. And furthermore, when you do deeper levels, you may find a lesion further along in the specimen. So there is extensive intra and inter-pathologist variability in diagnosing these processes. There was a recent study that showed the utility of, let me just get rid of that. There was a recent study which showed the utility of step sections in biopsy samples initially diagnosed as actinic keratosis, and this essentially found that 33% of specimens had further additional diagnostic findings, including 13% with squamous cell carcinoma in situ, 4% with basal cell carcinoma, and 3% with invasive squamous cell carcinoma. So in other words, you can always find extra pathology if you cut. In fact, if you add this up, this is 20% extra cancers are found if you cut deeper into biopsies than you routinely cut. So I just found a case today which I thought I'd use to highlight this process. It's a 75-year-old man with a biopsy on the back of the hand, and the question mark was query SCC. So this is the low power. You can see the marked solar damage here, and on this end of the biopsy you can see a fairly classic solar or actinic keratosis with mild or moderate dysplasia, which is predominantly in the basal part of the epidermis, and the superficial part of the epidermis is essentially normal. A little bit higher power of this shows the same thing. The next level found slightly more full thickness atypia and a little bit more budding downwards of the epidermis, and a higher power of this shows a similar sort of thing. And then in the very deepest levels, you can see much more extensive budding downwards and full thickness dysplasia. So essentially, as you've cut deeper into this block, you've found more, at least in situ squamous cell carcinoma. As you can see, it can be very difficult to determine if these nests are actually invasive squamous cell carcinoma or just in situ squamous cell carcinoma, and the distinction is probably not very difficult when it's early squamous cell carcinoma. Sorry, the distinction is probably not that necessary when it's early squamous cell carcinoma. And this is a higher power of the same thing, and one essentially can't tell whether these nests up here are invasive or not. I reckon this is probably early invasive squamous cell carcinoma. So the bottom line is this is a continuous process. There are no cutoffs. And what I do is I treat these clinicopathologically. Tell all patients that they've got biopsy showing that it's early on the way to squamous cell carcinoma, and that you can't entirely exclude that it's got roots. I tell them we're going to treat it clinically. We're going to treat it topically if you choose topical treatment, but that they must return if it doesn't go away or recurs. So I always tell patients to come back if the lesions are not are not treated properly. And usually, if it's especially on the back of the hands or sun damaged skin, I correct the remaining lesions. So the big conundrum in pathology and clinical literature at the moment is, are actinic keratosis benign? And some people call them benign, some people call them precancerous, other people call them squamous cell carcinomas. Well, the bottom line is it's all part of the same process, and as I said, I usually say to patients, this is early on the road to squamous cell carcinoma. I don't call them benign or precancerous. As I said, I usually tell them they're on the way. Anyway, thanks for listening to this discussion.